Well, hello, Miranda. Welcome to the Dental Hygiene Basics podcast. Just for everyone listening, my name is Dana. I'm your host, and we're very excited to have special guest Miranda here with us today. Miranda, the first question I always ask my guests is basically just tell me your RDH origin story. How did you get to this point?
Yes. All right. Love it. Well, thank you for having me, first of all. I'm really happy to be here. So, my first degree actually is in English, and it's that one up there. I graduated in 2009, was not a great year to graduate college. Economy wasn't doing very well. I moved to Nevada and I took the first job that accepted me, and it was for a 10 office dental group. So I was working in corporate in Dentrix. I lived in the ledger and I just audited payments all day. I like printed out payments and I would go line by line, making sure insurance paid what they should. Should we write it off? Do we bill the patient? It was very mundane. But I realized in working in the office that I wanted to be on the other side of the wall, kind of doing what the hygienists were doing. So moved back to the East Coast. I'm originally from West Virginia. And I applied to a school in Virginia. I lived on the state line. So this school where I got this degree was actually just like a 45, 50-minute drive from me. I applied, took my prereqs that year, a lot of transfers from the first degree. Fortunately, I only had to take like maybe 2 or 3 prereqs. Got in after the first year I applied, thank God. And that's where I went to school, Wytheville Community College in Wytheville, Virginia. My freshman year was a CODA accreditation year for them to renew their accreditation. So that was rough. We had quite a few people drop out, but it was really one of the best things I've ever done for my career. Unfortunately, I did tear a ligament in my wrist. So I moved straight to California, practiced through the pandemic, and then I tore a ligament right here. That is your TFCC. And so I kind of had to pivot. I was in a brace for 3 months. I had to go through some physical therapy. So I transitioned into sales when a recruiter reached out to me.
Wow. Was the ligament injury related to hygiene? Like, did you hurt it working or was it just something outside of that?
So they said it was a combination of two things. They said the first one, it was already weakened from repetitive motion injury. Wonder how I got that. And then I was lifting something heavy out of the back of a car and I felt something snap, like right here, just like a little snap. And the snap itself wasn't painful. The pain came later. Then it was numb. And then I started dropping things. So that was really alarming for me. So x-ray said it's a torn ligament. I learned what a TFCC was. And then I was in a brace and physical therapy for 3 months.
Wow. So no surgery or anything needed, but still quite an
Mhm.
extensive recovery time. And in that time, you can't practice because are you right-handed? I saw you hold up your right hand,
Yeah.
but
Yeah,
yeah.
that's it. Yeah, dominant hand. That's what it was. So, you
Wow.
can't make much money just holding a mirror. And I was panicking. I was like, I've spent a lot of time and tears and still paying off my student loans. Have I ruined, my future? And that recruiter contacted me and I just said yes. I believed in the product and that's my number one. I won't sell it if I don't believe in it. And I took the jump and it's one of the best things that I've done for myself. And so it kind of was just steps in leading me to where I am now.
Yeah, I feel the same way. Sometimes we get scared about the future, what can happen. I'm always like a mental doomsday prepper in my mind. I'm like, this could happen or this could happen. But one thing I've tried to kind of just change in my mind the way I think about things is think of all the things that have gone wrong in your life or that didn't go the way you wanted them to, or, could have ended your career. I'll put it in parentheses, right? But you learn to pivot and change, and then you end up in exactly where you're supposed to be, or at least
Mhm.
that's my thought process behind it. So how long did you practice clinically before you shifted into sales?
I had practiced 5 years.
Okay,
Yeah.
gotcha. Yeah. And so in that 5 years, was it straight clinical or had you done anything kind of getting you ready for sales or anything along those lines? No.
No, no, it was clinical. I mean, I had worked one holiday at my local mall, selling some clothes, but like I didn't have really sales experience in that formal way. So I kind of had to shift how you look at selling something. I think sometimes sales, the word gets a bad rap because you think of someone who's trying to pull one over on you, right? Or get you to pay more than you should for something, or they're selling you something of bad quality, like that car salesman kind of thing. And I'll admit I had that kind of thought at first. But I had to realize that what I had been doing in clinical actually, in a way, was sales. I believed in the product, which it was usually I'm trying to convince someone for periotherapy. And when I believe in it, I'm trying to convince them and fill in that knowledge gap to get them to buy into what I believe is best for them. So I had to realize that a lot of that I had already been doing, even through clinical.
Yeah, really good point to make. I mean, I always say, like you, I can sell anything I believe in. I can sell treatment because I know that I did the assessments, I diagnosed the patient correctly. And now I just need to explain it to them in a way that makes them see the value in what I need to provide for them, right? To get them
Mhm,
back to health. That's what sales is. But, we dress it up and sugarcoat it as education, and
mhm,
I really think sales is just another form of education. And so I don't think I've actually had someone in sales, at least not in dental sales, that I can remember on the podcast. So I'm really excited to have this conversation. And, you do some conversations on you say you don't call it a podcast. I think you're a glorified podcaster now. Like you're there. You're a part of the podcasting crew, but you're basically going through meeting with people and discussing alternative pathways. Can you tell us a little bit about that?
Yeah. So I initially started out my channel with just me speaking to the camera and talking about different subjects like different sales theories, transferable skills. But I realized that someone could find their way to my channel. And when I give that healthy dose of reality, they realize very quickly, I don't think this is what I want to do. And that's okay. I wanted there to be a playlist on my channel where I bring in my friends and I say, okay, well, maybe sales isn't it. That's my specialty. Have you talked to this person? Have you considered education? Have you considered doing alternative practice or direct access to care? Have you considered temping? That's another one that I want to do is temping. And I wanted it to feel like this. Let's say you and I are hygienists. We work at the same office. We're both sitting down in the break room at lunch. It's just the two of us at the table and no one's coming through that door. And you tell me, Miranda, I don't know how much longer I can do this. If you told me that, then this is what I would say to you. What are you thinking of doing? Have you thought about the finances? Have you thought about this or that? It's just me telling you these things from as someone who wishes I had learned this stuff 4 years ago.
Yeah, I absolutely love that because I had a student, well, actually she was a former student and then she graduated a couple years ago and she reached out and she had done some of my tutoring and so she's like, "Hey, I just feel like maybe clinical is not it for me for the rest of my career." Which I get. And that's one thing I'm always telling students. I see it on TikTok all the time. Someone's like, "Should I do dental hygiene or should I do this profession?" And I'm like,
Mhm,
"Do both. Who says you have to do one?" I'm like, "Do one and then work part time and work on the other, right? Or do
mhm.
sales part time and work clinical part time." For me, I love to educate. I do education, but I like to be clinical one day a week. So I still do clinical one day a week. And I really just think the opportunities are endless. And the more that we can share those stories for people who are in that thought process, I think it's good for them to hear. And I'm excited to share your sales story because, like I said, I don't think I've ever had anyone else on who really talks about it to your level and to your knowledge. So I'm really excited. Maybe we can funnel some students or maybe even people who are graduating who think maybe sales is for me over to your channel as well. But I do want to kind of backtrack just a little bit and talk a little about your dental hygiene school experience. So, tell me a little bit about your experience, maybe thinking through your first semester. What was it like transitioning into dental hygiene school?
So I thought that it was going to be, I guess, easier than it was for me because I already had a 4 year degree, but that was in the arts. It wasn't in a trade. So for me, I graduated my bachelor's with a 4.0. I was valedictorian. I kind of knew the formula. When you leave that and you go into an allied health trade kind of program, it's very different. And I actually found my first gray hair of my life within the first 6 weeks of my first semester. If that tells you anything about the stress, we lost 3 people the first 6 weeks. It was really a watershed moment where you have to decide, am I going to commit to this almost military type schedule, or is this not for me? We had a very small class, and by the end, I think we started with 20, we graduated with 16, and it was just this level of dedication and personal commitment that I had never seen before. We saw each other all day, every day. No one wasn't there. Like, no one was absent. Like, it was just everyone bought in continuously. The CODA accreditation was difficult. So everyone's minding their P's and Q's. You have to have documentation. That added an extra layer of stress to us. But once we saw it through on the other side of even just that CODA accreditation year and knew we were going to become second year seniors, it really was the most rewarding thing. And when I, got through that first year, I thought if I can get through this the second year, it's okay.
Yeah, now we're cooking with gas, right? I know. And
Mhm.
just for students who are listening, you may have heard Miranda mention the CODA accreditation. We need to go to an accredited dental hygiene program in order to get your license. If you're interested in a little bit of talk about accreditation, I had Leah Hargrave on, and she talked about how her program was only regionally accredited, and that did impact her ability to get accepted into a bachelor's program. It took a lot more kind of finagling to make that work, which was something I never heard about before. But in order for your school to be accredited, they have to go through this process. It's kind of like, how would you describe it, Miranda? Like an audit on the program?
It is. I would consider it an audit to continue your level of accreditation. So almost like renewing, but instead of you just like paying a fee to renew, they come in and it's a very intense audit. I don't remember how often it's done though.
I think it's every 7 years. Don't quote me on that.
I was thinking seven too, but I didn't know if I was just thinking taxes or like
Yeah. Statute of limitations. Yeah, like
yeah.
everything's 7 year. I'm pretty sure it's every 7 years. And when that happens, faculty are incredibly stressed. And like you said, everything has to be to the T, the documentation. So it is very stressful on the instructors. And it's also very stressful on the students as well, because we feed into other people's energy and it's just a trickle down, right? Whatever's happening at the top is happening at the bottom as well. Now, beyond the CODA accreditation, I just kind of thought about, you have a background, your bachelor's was in English. What were you thinking about doing before the recession and all of the fun
I
things of
was
two?
yeah, I was gonna be an English teacher, English and drama. So I was a theater kid. Anyone who spent any amount of time with me, in dental meetings or like I was at ADHA Long Beach last weekend, my friend said, "Wow, yeah, theater kid. I can see it." Because I'm just a yes and person. You tell me what to do and it's like improv. I'll bounce off of you. So that was my dream was to be English and drama teacher, but to do that I wanted to get my master's and I had already been approved. I was going to go to Eastern Tennessee State University and get my master's in professional communications. And I just pulled the cord at the last minute. I was like, the economy is tanking and I'm not taking on even more debt. So I just backed out. And looking back, I don't regret it.
Good. Yeah. Cause I
Yeah,
mean, you were on one very straightforward trajectory, and it is possible to make a major shift and make a complete change. So if you were talking to someone who's going through that right now, who's like, man, I already have a degree in this and now I'm thinking about a full shift, what would you tell them?
a degree is not going to hold you back. It's just going to give you possibly credits to transfer. And I know at the time it feels like I wasted certain years going down a certain path and I almost have to put it in reverse and then go somewhere else. But the truth is, if you know in your heart that you're going to regret not trying it, there's no better time than now. Don't waste any more time if you feel like you already have. Just see what credits will transfer and make that move because there's no better time than the present.
Absolutely. And life keeps moving forward, whether you decide to stay where you're at or to progress, in a different direction. And I just think we have to listen to ourselves and trust that instinct a little bit. And yours was telling you something different. And then I look at all the amazing things you've done since then. And I'm like, it was a great move for you to make that decision and do.
It was. And I was the oldest person in my graduating class. I was
Really?
28, and that was considered old for my class. And at the time, I was a little embarrassed. But you know what? I'm 38 now, and I'm very proud of what I've accomplished. So there's no reason to let your age or the number of years behind you hold you back because that's only going to give you more experience and make you stronger for what you want to go towards. So um, you'll never regret starting now.
Yeah. Okay. Wait, what year did you graduate?
2016.
Okay, I was 2015. You said 10 years. I just hit my 10-year mark. So I was like, I keep meeting people who graduated in 2015, but just 1 year behind. No, and I
Mhm.
was 27 and I felt the same too. I felt old compared to some of my classmates, but thankfully we had a good mix. So I would kind of felt maybe a little towards the older scale, but it's okay to have a life lived before going to dental hygiene school and to experience different things and to make that pivot when you decide the time is right. I love
Mhm.
that. Okay, so thinking about dental hygiene school, what kind of advice would you give to a student who's in it right now?
Well, I can imagine that since I was in it, the requirements have changed. There's a whole thing that happened about 5 years ago that probably has changed, some of the clinical things, I would say. But as far as I think the structure and your own systems, I think that's the biggest thing is you have to set yourself up for success, and that includes your own systems. I mean, I lived by my schedule. I lived by my calendar. I just set myself up to be very organized. And I didn't see any other path except the finish line. Everything else was just a speed bump, really. Or if it was a hurdle, I was going to get over it. It's like that is a small thing compared to the finish line, graduation date, May 2016, whatever it is. And when you have that singularity of focus, there's no make or break moments. Everything's just a little hurdle or a little speed bump, and you just keep going. So I think organization and just that like almost blinders on to the very end will help you put everything in perspective.
Yeah, that's such a good point. You have to be able to visualize the end goal and, like you said, put those blinders on because it can be hard. Sometimes I see students getting distracted by other students, whether it's competition. Sometimes it's some students that are really struggling and maybe don't have those blinders and that focus on, or are going through personal things that's making it really difficult for them to be successful in the program. So you have to remember that when it comes to dental hygiene program, your goal is to graduate and become a dental hygienist, right? It's not that you shouldn't help others. It's just that you have to make sure you're in control of your own destiny first, right? Yeah, that's really great advice. You mentioned Miranda student loans and how that was a little scary, injuring your wrists and how you still had loans to pay off. Is that the primary way that you funded dental hygiene school?
Yes. So I had a scholarship for my first degree. So this was the first time I was ever taking out student loans when I went for my associate for dental hygiene. So I did take out loans and I took out the max. Fortunately, I did get in-state tuition because my school offered within a radius. They offered in-state tuition, so I did qualify for that. It wasn't really enough for me to live on though because I had to dedicate so much of my Monday through Friday at the school and I had a lot of gas because it took me 50 minutes one way, but I did have to kind of live on credit cards at a certain point. I had pretty good credit, so I would get 0% APR credit cards. I'm not condoning this, but I had to play the game. Again, I just had this one focus, like I'm going to pay it off. And once I graduated, I paid off all my credit cards in a year. So I focused on that. I paid off all my credit cards first, and then I was working on my loans. But yeah, it was rough because I could only work about 20 hours a week. I was working as a switchboard operator in a hospital. So I worked Saturdays and Sundays, 7 a.m. to 3 p.m. I worked Thursday evenings, and then I was doing school. So I did not have a day off. But again, like I just didn't see any other path. Like this was the small setback to get me where I wanted to go.
Yeah. And we think about the big picture, dental hygiene school is 2 years. Not
Mhm.
that I want you to be miserable for 2 years of your life, because life is short, but there is a point where you have to put the focus on the most important thing, which is getting to the finish line and graduating, right? I love that.
Mhm.
So tell me a little bit, because I always warn students about this. I say the danger with loans and with debt is that if you get injured, you can't practice the job that you've been trained to practice. But
Mhm.
you were able to pivot successfully into sales. What do you think it takes to make that pivot? I mean, besides being forced to, I guess a little bit,
Uh,
but mentality wise, what do you think it takes to make that pivot?
So I think that there are quite a few things, and I kind of go into them on my channel. I think one of the biggest mindsets that you have to break out of, and I have a video entirely dedicated to this, is creativity. We are bound by the four walls of our operatory, our schedule on the screen, and the one human in our chair. And we do that repetitively. And that's great. But when you're in sales, all of a sudden your entire territory is your oyster and you have to go out. If you're inside four walls that are your office, you're probably not making money. So all of a sudden you have to find new ways to um, be creative, come up with events, lunch and learns, networking. It's just so outward and external. So I think that if you're not one who's prone to that or you don't like doing that, then sales is probably not going to be that easy for you because you really need to have that outgoing, outward forward thinking, proactive mentality. Whereas in hygiene, it's very structured, very routine, scope of practice. This is what I do. This is what I don't.
Yeah, such a good point. I mean, even though hygienists tend to have similar personalities, we're type A, and not everyone too. And I've met amazing type B, and they have admitted to me, they're like, I'm a type B hygienist. I'm like, I love it. I'm here for it. We do still have individual strengths. For me, I'm an introvert extrovert. Like to go out and do that all the time would be really, really hard on me. When I do it, I can do it really well, but then I'm like, I need to recover for a week from that one event. But putting yourself out there and, like you said, being forward thinking and creative, you might hear that and be like, dang, that sounds really good. But you may be in the other camp. And I think we don't talk about the other camp enough, which are people who are happy in the op too, right? And you can be your own saleswoman in the op with the treatment that you're doing. Or, I mean, I'm sure that there's ways to connect with sales companies and work inside of the op as well, right? You kind of did some of that with when you were training on airflow, right? Were you going into offices and teaching hygienists?
Yes. So that was my job essentially. Someone wanted a demo. My job was to take the device into their office and show them what it was like on prop tools, and they could feel what it felt like from the clinician's standpoint. Demos are really great because as clinicians, you can speak that language to them. That's one of the greatest strengths that we have if we go into any type of sales is that we are suddenly on that level with them. And I used to hide it so that they wouldn't know yet, and I would, like, hide my tooth tattoo so that they wouldn't know that I was in it. They would see me as a salesperson, and then I would just say something super clinical, just, like, roll it off, and they would go, "Are you a hygienist?" I'd be like, "Oh, yeah." And you could almost see, like, the barrier go down with them. It was like this, you're a salesperson kind of wall that they have, like, it comes down because all of a sudden you can say, "I really have been in the trenches. I know what you're talking about," and it just gives you a more even playing field.
Yeah, absolutely. And when I just think about the level of knowledge that we have as dental hygienists, and sometimes you see people working for sales companies and they're selling you a product, telling you how great it is, but they've never used it because they're not a clinical provider. And I'm
Mhm.
not hating on those people. I know that they know everything there is to know about whatever it is that they're selling, but at the same time, someone who's used it or someone who's placed it in the mouth or done something like that, it does build a level of trust. And I really think hygienists are uniquely suited to step into sales roles very easily because, like you said, we're already selling treatment and we already know the skill and we know what hygienists need and how it's going to make their life better, easier, or their patients healthier. So I love that. I think it's a great thing to consider for anyone moving forward.
Mhm. Not even if you're selling hygiene products, even if you're selling specialty items or restorative, just if you're talking to a specialist, like I've spoken to general dentists and periodontists, is as long as you can say, I'm a hygienist and I've worked in private practice and I know what XYZ is, it really doesn't matter what you're selling in dental. You come with a certain level of credibility that you've been in that office workflow. You know what it's like to run behind schedule. Nothing's been sterilized, like the whole thing, like you just know. So it comes with a lot of credibility no matter what you're selling.
Yeah. And, one thing that we were talking about before we hit record is job markets. And right now we know that the job market for clinical dental hygienists is pretty open. They need them, right? Everyone needs a clinical hygienist. And it's kind of like the world's your oyster if you are looking to work clinically. But sales jobs right now are maybe not as prevalent, would you say?
Yes, I would say that. I like to keep my finger on the pulse of sales jobs, both dental and medical in general. And there's definitely been a tougher market recently.
Yeah, and that's where I think the more you try new things, right? And you pivot and you're like, well, maybe I am a little burnt out in the op, but maybe I could try sales, a couple days a week or one day or whatever it may be. When the market shifts and turns, you are no longer stuck. right? Because I just think of all the unique skills you've gained between both your well, with everything you have, your English degree, your dental hygiene degree, your clinical experience, your sales experience. I just think now nothing could stop you regardless of the job market.
Thank you. Thank you.
Yeah, yeah.
One thing that I like to say, it's there's no better time than now to at least get your foot in the door. At least, look at your resume and see how you can tailor it that it might shine better in a sales environment. Get on LinkedIn, follow your favorite dental brands, try to network with those people, at least follow the recruiters and the hiring managers, because you're kind of like a tiger crouched in the bushes. You don't have to get ready if you stay ready. And there's no better time to make those connections than when you don't need them, or when the fish aren't biting, so to say, so that when the market is better, you're ready to pounce.
Yeah, that is such good advice. I mean, you're so right. And that's what we always try and tell people, networking, 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 getting your name out there, meeting people. And that starts the moment you decide you want to work in the dental field, right? It's the first office that you shadow at, it's all of the professors that you meet in school and all of the classmates that you meet. And I felt the same way when I was in school. Once I realized, dang, I can be an educator. I was spending more time with my instructors. I was like, what do I got to do? As soon as I graduated, I was like making the moves because I knew kind of the forward path. But, I've talked about this a lot on the show, but I have a career bucket list. It's things that I want to try and I stay crouched, right? It's like when I'm ready to jump into the next thing, whatever that may be, I'm building on that a little bit every day, getting prepared for it. That is seriously incredible advice, Miranda. I love that. Well, I just want to say thank you so much for being here. Would you just share where our students can find you and, listen to your not a podcast? What
My
would you call it? Your YouTube?
My YouTube channel. Yeah,
Your
yeah.
YouTube
I
channel.
did I did YouTube because that's just kind of how I consume content. So, I try to get my videos all under like 15 minutes. So just really, bite-sized pieces. I'm on Instagram at miranda.rdh, and then my full name, Miranda Linkous RDH, on YouTube. But if you search Miranda RDH on YouTube, you will find me.
Okay, awesome. Thank you so much, Miranda. I appreciate you.
Thank you so much.